Welcome back to the channel. I'm Dr. Vinay Prasad. I'm a practicing HEMONC doctor. I'm a professor of epidemiology. Today's video is entitled, Why Joe Biden Needs New COVID Advisors. Rochelle Walensky, Ashish Jha, Peter Marks, Vivek Murthy, Anthony Fauci, they all have to go. They have failed too many times this pandemic, particularly in the last 2 years. I think they need to all be fired. And the Democrats need to do that to get a clean slate on COVID-19. Their COVID-19 policy is out of touch with American people. And I'm going to run through some of the decisions that these advisors have made. I want to be very clear. These happen to be Democratic advisors, but they're not the only Democrats with COVID-19 views. There are other Democrats with different views, different policy preferences. You're going to want to have some of those people involved in these decisions. Pragmatists, realists, centrists, and not extremists. So let's run through the issues of what these people got wrong and why Joe Biden needs to fire them all. But I guess the first thing to say is, of course, Joe Biden's probably not making these decisions himself. He's relying on other people to make these decisions. I doubt he knows that much about COVID-19 policy himself. So let's run through their decisions. Masking toddlers. Am I really to believe that anyone in America actually thinks this was a good idea to mask kids between the ages of 2 through 5, to keep that mandate in place for Head Start programs until a federal judge stripped it away? Does anyone think that that was a sound idea? It was clearly nonsensical. The World Health Organization, UNICEF, they explicitly said, do not mask kids under the age of 6. We went beyond that and did this. We had not a shred of credible data. It defied common sense to do this. Naturally, people were upset by this because you're masking very young children, and every professional organization gaslit the American people. The AAP said kids don't need to see faces because kids who are blind learn to speak just fine. That was absolutely ridiculous. Everyone fell in line with the political left view that masking toddlers was A-okay and in fact a good thing. Makes no sense. They were the lowest risk of the virus. It had no credible evidence. And as I'm going to say, they didn't run studies to advance that knowledge. It was I think, deeply unpopular position, and it will just get more unpopular as time goes on. And people realize that you have to be, kind of nuts to think that that would be a useful strategy. Masking any school kids. The two very best studies on this topic are from Spain and Finland, and they take advantage of a natural experiment. In Finland, 2 different cities with different masking policies for, I believe, kids between the ages of 10 and 12. And in Spain, the advantage of below a certain age, they didn't mask. Above a certain age, they did. And you could do a regression discontinuity study for the R coefficient right around that transition point. And in fact, on this channel, I've covered both of those things. Those are the best studies of masking school kids. They are pretty negative. It's not going to have a large impact. And yet this administration continued to push that long after vaccines were available for elderly and adults. These advisors thought that this was an important policy. I remember back in September of 2021 when I wrote the article in The Atlantic saying the downsides of masking school children are far more certain than the upsides. And I remember the pushback I got. That was 8 months after a widespread vaccination campaign. And this administration anchored on to this delusional belief that we ought to mask school kids. The United Kingdom, of course, as quickly as they removed it, and they actually never masked elementary school kids, as the United Kingdom professor told me, because we're not crazy. 0 cluster randomized control trials. What do I mean by this? These advisors actually took the power and the massive power of the federal government, of NIAID, of the CDC, and they literally ran 0 cluster randomized control trials. In other words, they didn't use the premier method of science to figure out if something works, how much benefit it has, if its harms outweigh the benefits, what the trade-offs are. They didn't use that tool, not even once in the entire pandemic, not even once. They kept saying follow the science, but they proved themselves to be ignorant scientists because they didn't take advantage of the greatest tool modern science has, which is randomization. They didn't test the different distancing strategies. We were embroiled in a big debate about 6 feet versus 3 feet and the big difference that would make. And it did make a practical difference because it meant staggered class schedules or different bus schedules. And they didn't test that rigorously. We had to rely on Emily Oster doing an uncontrolled study. That was the best we got. They didn't randomize different cohorting strategies for schools, the quarantine policies, the fact that if one kid tested positive, so many other kids were kept out of school, which, by the way, now I'm reading polls that show a huge decline. Well, there's not a poll, a huge decline in test scores. And then people are saying, well, they've declined also in places that had open school. But a school that's open with a draconian quarantine policy that if one kid gets sick with COVID, all the other kids have to stay out of the class for 10 days or something like that, that's not a really open school. That's a disruption. You need to look at disruptions. In-person learning is good for educational outcomes, and any disruption from that is very bad. And creating a stupid quarantine policy, and I said the whole time how silly it was. And sure enough, it's proven to be silly now because nobody has it, nobody cares about it, and all the kids got COVID anyway. We have an 86% seroprevalence rate by the CDC's own estimate. That's likely to be an underrepresentation. It's lagging. It's already a little bit old. And there's some kids who've had it and cleared it, and they're not testing positive by anti-nuclear capsid antibodies. They didn't run any cluster randomized trials of different testing strategies. They just kept saying testing, 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 but no one could operationalize that practically with robust evidence because they've never studied that strategy, and they didn't study masking. They didn't study masking in young kids or old kids or adults or community masking rules or policies. I cannot overstate how foolish this was. There's no point in being in charge of these agencies if you can't use science to minimize uncertainty. You are a total failure. You will turn a scientific debate into a political debate if you don't provide evidence. They never provided evidence. They just kept saying louder and louder that they were right. And that to me is not the hallmark of a scientist. That's another reason they have to go. The kids under 5 vaccine disaster. Oh, it was a disaster. The regulatory hurdle for the vaccination for kids between 6 months and 4 years old was to show non-inferior geometric mean antibody titers against the Wuhan strain of the virus. Pfizer ran that study, 2 doses in that group, and they failed to meet the non-inferiority margin. Non-inferior antibody titers, that doesn't mean the kids are better off as a result, particularly as natural immunity started to grow in the population. It was the lowest of low benchmarks, and they failed to meet that. This administration gave them a second chance, but it was a third chance. It was a third dose. And then they allowed them to try again for non-inferior geometric mean antibodies, which they eventually sated. That was already, I think, an error. You should have made them go back to the drawing board and run a new study at a different dose. Or arguably, you should never have allowed antibody titers for the youngest population. You need clinical trial outcome measuring clinical outcomes. There are surrogate outcomes and there are clinical outcomes. Here, what's the difference? A surrogate is an endpoint the patient didn't know mattered until the doctor told them it mattered, like your blood sugar level or your LDL level. To you, that doesn't mean anything, but it only means something because it's correlated with living a longer or better life, free of stroke, free of neuropathy. So that matters to you. To be a useful surrogate, you need to prove that many, many drugs that lower the surrogate in a variety of settings also lower the clinical endpoint. They also improve the clinical endpoint. And that is what it means to validate a surrogate. They marched forward using a surrogate, antibody titers, without having done the appropriate validation studies. And to some degree, it's difficult to do the appropriate validation studies because we're always chasing a moving target with COVID-19. It's always changing. And there's an easy way around this whole problem, which is you don't need to use a surrogate at all. You can actually directly measure the endpoint you care about with a larger randomized control trial. So back to the story. So then they failed. They gave him a third chance. But then remember, in February, there was this big brouhaha that the trial actually had a statistically significant reduction in symptomatic SARS-CoV-2 in these very young kids. And they announced an ODAC meeting would be had, and the FDA requested Pfizer submit the application for EUA in February. And then as they got closer to the meeting date, many critics pointed out, myself included, that this was a non-primary endpoint of the study, that it could be a chance alone event, that these curves have split by chance at that moment, and that they will converge with greater time. And then just at the moment the VRBAC was about to be held, the Vaccine Advisory Committee, they withdrew the application because presumably the curves didn't look so good. A few months later, fast forward, they ended up giving EUA authorization for the kids under 5 vaccine. They never had really credible data of a reduction in symptomatic disease, at least for the Pfizer product. The Moderna product looked a little bit better, but it was already a little bit out of date, that data. And the uptake was predictably abysmal. I think to this date, less than 6% of parents have given their kids of this age even the first shot. That's the CDC's own data at the last meeting. And yet, despite all this, they just added this vaccination to the CDC immunization schedule. That's how bad they are at their job, that they took a vaccine that nobody wanted, that didn't have credible data, that they pushed through, that they tried to bend over backwards to push through based on a non-pre-specified look at a secondary endpoint, and then had to walk away from that when that blew up in their face in February. And they nevertheless added it to the vaccine schedule. one of the most contentious vaccines for kids. They are adding it to the vaccine schedule and equating COVID-19 vaccination with MMR vaccination, where one is tried and true and been around a long time, and it's really important we get a certain level of immunity so that we can quell measles outbreaks, and the other one is something that there is ambiguity to and there is legitimate disagreement to, and they've equated the two, and that is boneheaded policy. Today, the European Medicines Agency just announced COVID-19 vaccines in small children. Quote, EMA recommends vaccinating primarily small children with underlying illness to protect them from hospitalization and death. They don't recommend vaccinating healthy kids, and they're certainly not recommending vaccinating healthy kids who've had and recovered from COVID-19. This is the European Medicines Agency. Our FDA and CDC is run by people so incompetent that the European organization is in diametric opposition to them. They are taking something that is a live scientific debate and they are using their heavy hand to say what the right answer is. That would be one thing if they had credible evidence, but they don't have credible evidence. And if they did have credible evidence, the European Medicines Agency would follow them, but they don't, and that's the root of their problem. DoorDash packs for vax. They announced yesterday that they're going to use DoorDash to deliver Paxlovid. They are in love with Paxlovid. They've spent billions of dollars on Paxlovid. Did you know the only available randomized control trial data for Paxlovid is in unvaccinated people who are at high risk of bad outcomes from COVID-19, who mostly didn't already have COVID-19? We don't really have terrific data in people who've been vaccinated, particularly with 3 or 4 or perhaps even now 5 doses of vaccine, who may have also already had COVID. We don't have data for that group. And obviously, the upper bound absolute risk reduction is going to be smaller, but it's possible that it's even decremental or harmful because the harms of the product don't go away magically. It has so many drug-drug interactions, so you have to stop all these other medications. It's unclear to me that it's going to be a successful strategy. They have bet so heavily on this product. And what the right answer would be is so simple. Pfizer has tons of capital. They have 100 billion reasons why they could study this product properly. They could run a randomized control trial of Paxlovid in vaccinated people and give you the answer. But this administration, it seems like they're working for Pfizer. They're not letting that trial, they're not demanding that trial. And so it's not getting done. Thankfully, the folks in the United Kingdom have the ongoing Panoramic study where they're running this study. And if Panoramic is negative, this group of leaders is going to eat so much crow for the rest of their careers. It will be a debacle like Tamiflu, but on steroids. It's going to be the biggest screw up in regulatory history in a quarter century if this product doesn't work. And there are preliminary reasons to think that might be the case because the molnupiravir data from Panoramic is negative. This could blow up in their face. I'll talk at the end why this happens, but it really happens because none of these people making the decisions has any competence in evidence-based medicine. They are partisans. They're people who are picked because they were good on cable TV, but they're not thoughtful scholars of evidence-based medicine. They don't understand you need data before you administer a therapy to millions of people. Before you have DoorDash deliver it, it would be nice to know if it actually helps people and who it helps. And above what age? Is there an age interaction? Does it work for people above 60 but not below? They don't know any of that. Bivalent booster without human data. They actually granted emergency use authorization under the auspices of an emergency. They have to evoke an emergency, which HHS Secretary has extended, to give this EUA to the bivalent booster on the basis of data in 8 to 10 mice. Ridiculous. At the same time, Biden's on 60 Minutes saying the pandemic is over. So which is it? Is it over or an emergency? You are contradicting the story. And of course, for the average American, it is over because they're back to normal. Yet they low regulatory bar for the bivalent booster. They don't just target 65-year-olds as some European nations are doing, or 50-year-olds and up as some European nations are doing. They target everybody from 5 years old and up. They're targeting the most ultra low risk population of people who mostly already had COVID-19, children, and they're granting this EUA, and that's empowering rogue actors like Yale University to just mandate it on students as they did just today, mandating this. We have no idea who benefits from a bivalent booster. Is it possible older people benefit? Absolutely, that's possible. Is it possible below some age they don't benefit? Absolutely. But what is that age? 65, 75, 85, or 25? I have no clue because you need randomized control trial. But it would be extremely unlikely in my mind that it would be that a 25-year-old would benefit. I think if anything, it's going to be on the higher end. That's a speculative guess. I have no data. Walensky got the bivalent booster, and then she herself got COVID 1 month later. That's got to be the moment in time with peak antibody titers from the bivalent booster. So they know for one thing, the vaccine effectiveness against any symptomatic disease is not 100%. It's lower than that. But what is the vaccine effectiveness? They have no clue. You have to do human studies to know the answer to that question, and you didn't do any. And if the VE comes back at less than 10%, they will look so foolish in the eyes of anyone who's actually paying attention to this. They will look like fools to approve a bivalent booster based on mouse data with a VE of 9%. Already, it's not looking good. There's the preprint. There's 2 preprints out now that say the addition of this bivalent booster to the prior doses doesn't generate more BA.5 antibodies than just another dose of the parent Wuhan strain. And that's very likely due to some imprinting, that you are making antibodies that you've already learned how to make, and you're not making new antibody against the novel epitopes that the vaccine is presenting. That's a big problem they're facing. That's not clinical data. It's not yet clinical data, but it really undermines the probability that clinical data will be optimistic. Boosting college kids who had COVID-19. These people running the show are so incompetent. They think that a 20-year-old man who had 3 doses of vaccine and just had BA.5, that person ought to get the bivalent booster. That's their recommendation. They have no human trial data to support that claim. They have no observational study data to support that claim. They're just making things up. And this is being codified into law in Yale's policy. And many other universities are following suit. A certain type of university, an elite, liberal, coastal university. But nonetheless, those are still kids too. Those are important kids. And this is all a runaway train based on delusional thinking and very, very bad medicine. You don't take ultra low risk populations and basically gamble with their health because you don't know for sure that they're going to derive a benefit from this product. And it's very likely that they may derive net harm because there's probably going to be a 1 in 10 to the power 5 risk of myocarditis, probably 1 in 10K, which is what Scharf found for the 3rd dose in that age group. If it's that, you really have to weigh that against what is the real probability of repeat hospitalization. Somebody's had 3 doses. And if you've already had Omicron, what are we doing this for? What are you doing this for? Mandates. This administration was the one that created the Biden mandate. They fired healthcare workers who have had and recovered from COVID-19 because they didn't get the vaccine. They pushed their mandate after they already had evidence this vaccine could not halt transmission. Let me repeat that. Provincetown taught them that this vaccine could not halt transmission, and yet they nonetheless pushed the mandate. A mandate is by definition unethical if the product cannot confer a benefit to a third party. There's a very nice NBER paper that Jay Bhattacharya just tweeted that looks at children and shows that in classrooms with more or less vaccinated kids, there's no reduction in the spread of COVID-19. This product does not appear to be able to stop spread. And I tell people that even if it has a modest effect on spread transiently, which is what it might have, that is all a wash with enough time. And let me give you the analogy I like to give. It's the Russian roulette analogy. Russian roulette. You put 1 bullet or a couple bullets in a gun, you spin it, you put it to your head, and you pull the trigger. It's not a fun game to play. I don't advise this game. I never want to play myself. If you play Russian roulette with 1 bullet, or you play Russian roulette with 3 bullets in that gun, I'd rather play it with 1 bullet. You got better odds that you're going to be 5 out of 6. It's not going to be you, but 1 out of 6 it is versus 3 out of 6. But if you have to play Russian roulette every single day, 20 times a day for the rest of your life, it really doesn't matter if you go from 3 bullets to 2 bullets, or 4 bullets to 2 bullets, or 4 bullets to 1 bullet. We all know how that game ends. And that's COVID-19. Even a vaccine that exerts a modest reduction in transmission potential for a short period of time will be washed away in the ocean of people in the world, the 8 billion people that you won't all be able to vaccinate all at once, the billions and tens of billions and hundreds of billions of interactions between people over the course of a year. You are basically spitting in the ocean. You're not going to make any lick of progress in terms of transmission broadly. And as such, mandates are always unethical, particularly for younger populations who have more to lose and far less to gain. Myocarditis. This administration, these advisors, they gaslit about myocarditis. Rochelle Walensky said, we've looked at 100 million doses. We haven't seen a signal. They must have known because that report was very clear from Israel, the first people to report in February 2021. It was clear in an EMA inquiry. And now, of course, they accept myocarditis. They went from there is no myocarditis to there is myocarditis, but it's not. It's 1 in 40,000 to actually it is 1 in 3 to 5,000 now that we've got our numbers together, which is what the Israelis said from the very beginning. But then they said, well, of course, it's mostly mild. But now we know from the Lancet paper, which I've talked about on this channel, it's not mostly mild. It's sometimes serious, and mostly if you have myocarditis in these data sets, you're being hospitalized. And that is by definition a serious adverse event by their own scoring criteria. So I wouldn't call that mild to take a 12-year-old and put him in the hospital for 3 days. And certainly Does it mostly resolve? It seems that way symptomatically, but there's still kids who are taking furosemide who still have late gadolinium enhancement abnormalities on MR that are persistent. It's unclear what the toll of this will be, and we have no idea about subclinical myocarditis, which I've talked about on this channel a couple times with the Thai paper, with the Swiss paper, because they have not made Pfizer generate those data, because this administration is so beholden to Albert Bourla. They have to do whatever Albert Bourla wants. They can't put pressure on him. If you work for government, you can't work for Albert Bourla. You have to put pressure on the company to generate data. They fail and fail and fail to do that, disgracefully. They didn't do anything to mitigate the safety signal. Once you knew about myocarditis, you should have at least tried to do something. Make Pfizer do a study of 20 micrograms in that group of people, in men. Maybe 15, maybe 10. Maybe space the doses further apart in randomized fashion. Don't just rely on observational data from Ontario. I think spacing is probably a successful strategy, at least the first 2 doses. I have to rely on observational data. But you could have tested a variety of strategies to try to preserve the efficacy but minimize the harm. They never did that. And that is, I think, a deep disrespect to the role of the FDA. And that is a deep disrespect to the American people. They won't be able to hold this back forever. I think it's obvious to me that this is what happened, and I think it'll be obvious to other people soon. They didn't give any exemptions for natural immunity. They still don't. Yale still is not putting that if you just had Omicron, maybe it's not a good idea for you to get this booster at all. They're saying that maybe you want to delay it a little bit, but they're not saying you do. They're not asking the question if you need it at all. They need to ask the question if you need it at all. There is an open question as to what benefit it's providing. It cannot provide a benefit for any symptomatic disease. You're eventually going to get it anyway. It's got to be on severe disease and hospitalization. They just don't know. They are deciding the fate of people who've had and recovered from COVID-19 based on an opinion poll of people who are not that bright. And I think that's one of the root of their problems. They missed the greatest opportunity. That's how wrong they are, which was the right COVID-19 policy was really simple. You tell people, we have tried very hard to keep COVID-19 at bay. We've taken different things. People have turned their lives upside down to do it. And we've closed schools. This is when they took over. Here's what they should have said. We now have a vaccine. It's really effective. It's very unlikely to be the case that there's going to be any other substantive difference in your risk of COVID-19 than vaccination. For older people, frailer people, vulnerable people, get your vaccine. We're going to give you 3 months to do it. And after 3 months, we're going to advise that life get 100% back to normal. Why? Because if there's breakthrough or not, we don't know, because we didn't ask the company to look for that, to look for transmission as part of their study. If there's breakthrough or not, we don't know. But we know the harms of holding society back are so great, and those harms cannot be allowed to continue in the face of the one product that transforms risk. Once you've gotten the vaccine, you've transformed your risk, and now you're just going to have to live with that residual risk the rest of your life. It's unlikely to get substantively better. So get back to your life after vaccination. If you don't want to do it, it's your choice, but we're going to let society get back to normal. They never did that. They just kept playing more and more games, masking, double masking, N95, social distance. They keep playing the same old games. They had no logical framework to think about COVID-19. They didn't understand that all policy interventions are in 3 buckets. 1, things that don't do anything. They're slaughtering a goat to make the rains come. They're totally useless. And that's most of what they did, from taping up playgrounds to closing schools to, cloth mask mandates. That's mostly useless. Just sort of slaughtering the goat kind of primitive stuff. There's a few things that might have substantively delayed COVID-19 acquisition, like turning life upside down and staying in your house all day, and wearing an N95 that's tight fitting. That might have actually delayed when you got it. And then the third bucket is things that actually lower your risk of bad outcomes when you meet the virus, like being vaccinated or losing weight or getting your medical problems under control. And once you do everything you can to optimize this bucket, there's nothing left to do in the other bucket. There's no more gain for delaying. You're just paying the price of getting back to life. And I see people still struggling with, when do I return to normal life? You have a choice to make. Either you're going to live a diminished life for however long you plan on living, decades and decades, or you get back to life, but it's not going to get much better in the future. Lying about schools. Right now, I see Ashish Jha saying, I was always for schools to be open. He had a number of very strict rules for schools to reopen that were so stringent it would essentially mean that schools would stay closed. I see Anthony Fauci saying, I was never for school closure. That's just frankly a lie. He was the architect of school closure, if anything. And when DeSantis reopened in 2020, he was on every TV channel saying what a bad idea that was. I guess I'm heartened to know that you have to lie about your school position these days, because as somebody who always wanted schools to be reopened from the summer of 2020 thereon, I'm glad they've all agreed that it was an error. But it's not good that the media allows them to continue to lie about their positions. We all know who was on the side of school reopening. It is Ron DeSantis, and who is on the side of school closure, and that is Gavin Newsom. That's just the facts. That's just what happened. I mean, I was alive. I have eyes and ears, and I remember what happened. That's it. Those are my thoughts. This administration has chosen particular COVID-19 policy advisors. They're not very good at their job. They're very, very bad. COVID-19 policy is extremely unpopular. Their Democratic position on COVID-19 policy is out of touch with most Americans. I suspect they're going to be demolished in a couple of weeks in November. If they want to have any shot of retaining the White House, any shot of retaining things in 2 more years from now, you need to fire every one of these people. You need to bring people who were actually against school closure and not people who are lying and saying they're against school closure. You need to bring people who wanted randomized trials of non-pharmacological interventions, who were skeptical of masking toddlers, who didn't want you to approve boosters in perpetuity based on mouse data, who want randomized data, who want to focus on the elderly and largely leave the young people alone. You need those kind of COVID centrists on your team. Joe, let go of these people. They may be loyal to you or whatever. They are a huge political liability. They are on the wrong side of every one of these issues. Their brain don't work well. They're not thinking clearly. They have a position that is indefensible. I don't understand why they take that position. I hear the CDC director is working remote. I don't know that to be true, but I worry that that is part of the problem, that they are elites who are out of touch with Americans. Travel this country and you will realize that nobody wants bivalent boosters based on mouse data. Nobody wants you to lower the bar so much to expedite a vaccine for little kids and then add it to the vaccine schedule. And proof that nobody wants it is no one is actually taking it. You've got 94%. We're not doing bivalent boosters. 96% we're not doing bivalent boosters. 94% we're not vaccinating our very young children. Nobody is doing this, okay? You are getting the answer to your question. You have anchored yourself to COVID extremists. Jettison them. Let them go. And my advice to Randy Weingartner is that if you want to protect the unions, you need to throw people under the bus. You have to say very clearly that we in the teacher union, we were influenced by, and name the names of every expert you met with who said reopening schools was a bad idea. If you don't throw those people under the bus, they're going to throw you under the bus, and schools will likely be, either way, they're probably going to be heavily privatized over the next decade, because they've proven that at a time of crisis, they failed the Americans' children. So those are my thoughts. Like, subscribe, comment on this video. Stay tuned for more videos. It's what you get on this channel. So until next time.